So in today's video, I'm just going to give you an update on my upper blepharoplasty. I had this done about 6 months ago. I had it done on April 18th, 2023, and today is October 11th. So I'm just like a week shy of 6 months. So I'm not wearing, a lot of eye makeup. I decided not to wear any eyeshadow. I have a little mascara on the edges there, but I didn't curl my eyelashes, anything like that, because I really wanted you to get a good look. So you can see what I'm talking about. And so, I'm just gonna give you an update on my surgery, just answer some questions that you might have, and also just give you some advice, just in case this is something that you are considering doing. So let's go ahead and jump in. So before I get started, I did want to say that I'm gonna have a video linked in my description box. I'm also gonna have it pinned to the top of my comment section. And it's a video that I put out right after I had the surgery, maybe, 3 weeks, a month. I'm not exactly sure. It might've been 2 weeks, but I just kind of showed you the healing process and stuff like that. So in case you're interested, I'm gonna go ahead and link that below. So the first thing that I'm sure that you wanna see is pictures of me before, especially if you're new to my channel. If you're not new to my channel, then you know how I looked before. But if you are new to my channel, this is what my eyes looked like before. They were extremely hooded. Now, I've always had hooded eyes, and I love hooded eyes. I feel like hooded eyes have such a bad rap, but I definitely love hooded eyes. I just did not like the extra skin that was hanging over the top of my eyelids, and it was actually coming down on the sides there, and it was just making me look like I was angry or upset. And I remember, whenever my daughter started asking me like, what's wrong? Are you okay? You look like you're upset or something, that's when I knew. I mean, who wants to hear that? Nobody wants to hear that. And of course, I was fine. I thought I had a pleasant look on my face, but I think it was because my eyes were so saggy. I think it was making me look like I was angry or that I was upset about something. And I just did not like the way that it looked. And it was just weighing on me so much. And it's kind of funny because I don't know that I would have even noticed it as much had I not been making YouTube videos. It's so crazy how much you notice when you are editing your videos and you're looking at yourself all the time. I mean, you might see yourself in the mirror and, when you're getting ready and stuff like that. But when you are talking, like, I didn't even know that I had certain mannerisms. I didn't know that I talked out of one side of my mouth a little bit more than the other. Like once, I can't remember which one it is. I think it might be this one. It's a little stronger. No, is it this side? I think it's this side. And this one's actually stronger. So it's weird. I had no idea that I was doing that. And so anyway, you really start to notice things and you really start to pick yourself apart when you are editing your videos all day. When I first came to YouTube, I was like, I look pretty good for my age, until I started seeing like videos of myself. I was like, oh my gosh, do my eyes look like that? I didn't realize that, I don't know, it's weird how much stuff that you really notice once you start filming. And it's kind of funny, when you are considering something like this, it's a very, very big decision to make. I mean, you could alter the look of your entire self, just by changing your eyes. And so it's almost like you have to get to that moment where you're like, I don't even care if I don't look like myself. It's going to be better than this, because I had gotten there. I felt like I just looked so angry all the time. And one of my eyes, it was this one, was so much more hooded than the other. There is still asymmetry. This one is still a little bit more hooded, but the skin just hung down right onto my eyelash line. And someday, it's funny because if I got a lot of sleep or if I drank a lot of water or something like that, then some days my eyes would look a little bit better. Now, the next thing that I know that most people want to know is how much it cost. And the only problem that I have, I want to say it was $4,000. And the reason I say I want to say is because I had 2 surgeries the same day. I actually had a breast implant exchange, and then I also had my upper eyelid surgery. And when you have 2 surgeries in one day, they give you discounts, and there's just certain costs that are shared between the two. I'm pretty sure that my breast implant exchange was $6,000 and then the eyes were $4,000. It might have been $65.35, but honestly, I was pretty shocked at how little it was. I did kind of think, I thought it was going to be about $5,000. I didn't think it would be $4,000. Certainly didn't think it would be in the $3,000s. I did want to mention that I also went to a plastic surgeon who does all of his surgeries in-house. So they have a whole surgery area in the same building, you know, and so it's not, I don't have to go to a hospital or anything like that. There still is a facility fee and of course anesthesia fee. I want to say the facility fee is about $700 or $800. The anesthesia fee is about $400, and then everything else, I don't know where the cost comes from, everything else, just because he's an expert, you know, and he went to school for a long time and he can charge that. So anyway, I'm pretty sure it was about $4,000. Now I also live in a small city, so it depends on where you live. If you live in New York or if you live in California, you know, things are probably going to be a little bit more expensive. But I live in a small city in South Texas, and so it was just, you know, I think everything's just a little bit cheaper, you know. Now I'm really not going to talk much about my breast implant exchange because I don't know, I might make a video about that. It's going to be a little bit difficult because I'm not about to show, you know, before and after pictures or anything like that. But, you know, I had my previous implants for about 24 years and they were in perfect condition. They really were. But they say that you're supposed to exchange implants like 10 years or something like that. I don't think that that's true at all. I didn't have any ripples. Mine were also under the muscle. And so, so I don't know if you would be able to see ripples under the muscle. I know that whenever I would bend over, I could feel, you could tell that there was some volume loss, but you could not visibly see it, you know, if I was just standing there without a top on or something like that. But because I've had them for 24 years, I'm like, I have to eventually change them out. So I originally just went in for a consultation for my eyes, and then I decided I'm gonna go ahead and, you know, since you're paying the consultation fee, you might as well talk about everything that you can. And so I decided I wanted to go ahead and talk about, you know, exchanging my breast implants. And then we just decided to do it. And I say we because, you know, my husband obviously discussed it. My husband didn't want me to change my boobs at all. He was like trying to talk me out of it. He was actually trying to talk me out of going bigger, actually. He knew that eventually I'd probably have to change them out, but he didn't want me to go any bigger, and I did. And so anyway, that's really the only thing that we had to discuss because he didn't want me to change anything about the way that I looked at the moment, you know. And my husband's never been like a major breast guy or anything like that. Even when I got my first set of implants, he was trying to talk me out of it. Like, why do you need them? You know, you look fine just the way you are. But of course I was not happy. And so anyway, he supported me, but then he did not want me to do it again this time. But I did, and I did go a little bit bigger. Anyway, that is for a whole other video, right? Okay, so back to the subject. We're gonna stick with eyes because I will get totally sidetracked. Okay, so I wanted to talk about the consultation. Now, my doctor did charge for a consultation. I wanna say it was either $100 or $150. I can't remember. I had called around a couple places and it was always between $100 and $150. And whatever, if you decided to go with him, the surgery, they would just apply it towards your surgery, you know, $100 or $150. Anyway, the reason I bring this up about the fee, typically I would be really hesitant to go to a plastic surgeon who did not charge a consultation fee. I would worry that they're not busy enough, you know. If you are not charging consultation fees, you probably want more business. I don't know. I would be really hesitant to go to somebody that didn't charge. But another reason I bring it up is because you need to get your money's worth when you go to that consultation. Don't leave any stone unturned. Discuss everything, every issue. Don't feel like you're putting them out. Somebody had left me a comment the other day and they told me that they had their under eyes done and a lower blepharoplasty. And she was saying that, you know, she didn't get the results that she wanted, that there was improvement, but she didn't get the results that she had hoped for. And then she just kind of, you know, left a little comment, kind of a PSA to all the other ladies who might read her comment saying like, if you go to the consultation, don't be intimidated by the doctor, you know, let them know everything that you want. And I wanted to reiterate that because I went in with a rehearsed, I was like so rehearsed in what I wanted to tell him as far as like my eyes were concerned. I had pictures. I made sure that he and I were on the same page. The last thing that you want to do, and you have to think about it in terms of, I'm paying you $100 for 1 hour. You know, a lot of times these appointments are really short. I mean, they could be 15 or 20 minutes. But if you want to sit there and talk, even if you just want to chit chat, you just paid $100 to chit chat with somebody, you know what I mean? So take that opportunity to really, you know, express your concerns and express what you do not want. And that's what I was really, really clear about. So whenever I went to my consultation, one thing that I had told him for sure is I was like, look, I have had hooded eyes my entire life. I've had them since I was young, you know, and I'm not interested in not having hooded eyes. When I come out of surgery, I still want to have hooded eyes. I just don't want all the excess skin. I didn't want the skin that was hanging down over the edges. That is what frustrated me. I would not have minded if the skin was still sitting on my eyelash line, as long as it wasn't overlapping on the edges. That was my biggest concern. And it was such a concern that I was considering only doing a brow lift, because I thought that that would fix it without changing my look. So in this consultation, I actually brought pictures also of what I did not want my eyes to look like. And I'll put up some pictures right here. Now, before I put these pictures up, I did want to say, if you have eyes like this, it's not that I'm thinking they're not beautiful. It's that I'm thinking I would not recognize myself if suddenly I had all this extra eyelid space that I've never had before, because I've had hooded eyes my whole life. I would be really, really sad. Do you remember Kenny Rogers? Remember when he had his surgery? He went from having hooded eyes, just real kind looking hooded eyes, and then all of a sudden it's almost like his eyes just totally changed his appearance completely. And that's kind of what my biggest fear was. And although I had gotten to the point, because you do have to get to that point where you're just like, I can't do it with these eyes anymore. Like I was just so frustrated. I even thought to myself, even if I do look different, it's going to be better than this, because I just felt like I looked so angry and just so tired and everything like that. However, in a perfect world, my eyes would just look like my eyes did when I was in my 30s, you know? And so that's what I was hoping for. And I feel like that's kind of what I got. As a matter of fact, I have a little bit more eyelid space now than I did in my 30s. And I'm not upset about it, because I feel like I still have hooded eyes. Everybody that I know, like personally, thinks that I look the same. I just look more refreshed. Like nobody has been like, wow, you look different. I remember right when I got them done, I did have a lot of extra eyelid space, and I was a little bit worried. It wasn't too much to where I was depressed, because I knew that some of it was swelling, and I know how the body heals and stuff like that. But I remember my older sister, she had made a comment, and she goes, I'm just not used to seeing you with all that eyelid space. You just don't, I want to say she said, you just don't look like Jenny, you know? And I remember being like, oh my God, oh no. And then as they healed, it came down and down, and I was glad. And so if you know, some people are looking for a lot of eyelid space. There are some people that go in and they don't want their hooded eyes. You know, maybe you want to experiment with all this eyeshadow. And so, you know, some of the pictures that I had brought in were pictures of women that did have a lot of eyelid space, that some women dream about having, you know what I mean? And like I said, it's beautiful. It just would not look like me. I would look like a totally different person. And I was not interested in that. I did not want to look like a different person. Now, there's also pictures that I've seen of women. You know, I used to be on realself.com all the time. And, you know, women would upload pictures. Some of them, I remember this one woman specifically, she was so upset because she got her eyelids done and she was left looking just really, really hollow, to where her skin, it's almost like she didn't have almost any skin left. And it would just kind of recede to the back of her eye sockets. And she just was very, very unhappy. And I was worried about that. And I was like, I'm just so afraid that I'm gonna have too much eyelid space. And as I'm in the middle of like expressing all my fears and, you know, concerns about getting this eyelid surgery and looking different after it and stuff like that, or not having hooded eyes, he like stopped me mid-sentence and he's like, I am not in the business of creating hollow eyes on women. And then I was like, oh God, thank you, thank you. I had not used the word hollow, but that's what I was thinking. Like I was thinking, you know, the botched jobs that I had seen, it's almost like they just looked real hollow, like they didn't have any fat or any skin left. Like I said, it just kind of receded behind the eye socket, and I was just afraid of that. So what I'm trying to say is, don't hesitate to use your time wisely when you're in that consultation. You know, express all of your fears, express all of your concerns, show him pictures. Had I shown him a picture of a woman with hollow looking eyes and he's like, well, you know, if you have extra skin or if you have extra fat, we might have to, had he said anything like that, I'd be like, I'm not going with you, you know, because I would know that that was a common outcome from him, you know. Anyway, he put my mind to rest about that, and he actually told me how he does the surgery. He said what he does is when I'm laid out on the table, on the surgery table, because he did not draw anything on my eyes before surgery. He didn't draw any lines. You know, I always see these pictures of like lines and stuff, like where they're gonna cut. He says, what I do when you're on the table is I pull up on the skin and he pulls on it until your eye kind of opens. Like they don't want the eye to open. They don't want to pull down on the brow. They want to take just enough skin and cut it right there in your crease so that you're not having any kind of brow compensation and you're still able to close your eyes, basically. And so, so I was like, so you don't draw anything on my eyes? And he's like, no. And you know, I guess it's not necessary because I feel like he did a great job. Now, another thing that I wanted to talk about is just having realistic expectations. You know, one of my eyes, this eye has always been more hooded than the other. Not always. Okay, let me go back because it wasn't always more hooded when I was young. You know, not when I was 10 and 11 and 12 and 13, probably not until I was like 20 something. And as I aged, not only did this eye start becoming more hooded, this brow started to drop more and more as I've aged. When I was young, they were even, you know, my brows were even, my eyelid space and everything was even. But as I've grown older, this brow has dropped. It might be hard to tell right now because, as most of you know, I tattooed my own eyebrows. I actually just tinted them today, like not even an hour ago. So they are probably extra dark, and I do have some eyebrow powder, but they always look super, super dark right after I tint them. So when I tattooed my eyebrows, I actually went higher on this side, and then I went underneath on this side to try to even them out because this one definitely sits lower, and it still does, even though I've done that to try to create, you know, an illusion. And I say that because after surgery, this eye was still more hooded. Now you can actually see eyelid space on both eyes. I feel like you can see a little bit more eyelid space on this eye. And I knew that that was gonna happen. He basically told me too, you know, there's very few people in the world, if any, that are perfectly symmetrical, and especially as we age, because we might sleep on one side of our face more often than the other or something like that. Because this brow sits lower, I knew that unless I got an eyelid lift and a brow lift, that they would stay asymmetrical. When I go like this and I barely lift up on this eye, it's like now they look identical, right? Yeah, they totally do. And so I would have to get a brow lift on this eye. Otherwise, if he took more skin off, then this eye might not close, or he might have compromised my brow and pulled it down further. So you have to be really careful about stuff like that. I remember I was watching a girl here on YouTube, and she had an upper blepharoplasty, and it just broke my heart because she did not get the outcome that she wanted. And her doctor basically said, well, it's due to brow compensation. He said that sometimes if you take too much skin off or something like that, that it can actually lower your brows. And I know that that can happen. But I would be so disappointed, and like I said, it just broke my heart because, you know, some people save forever to get a surgery like that, and then to have it not be the outcome that you want, it would just really, really be very depressing and sad. It made me so upset at this doctor when I watched all of her videos, and I was just like, oh, I'm so mad at that doctor. He's not even my doctor. But But anyway, so like I said, if you have one eye that's more hooded than the other, it's probably still going to be more hooded unless you also get like a brow lift or something like that. But I was not interested in getting both. I was going to do one or the other. I might eventually just get this one raised a little bit because I don't mind where this one sits and I don't want it to be too high. But this one has always come down lower on this side. This temple was always more hollow. This brow has always, like, this whole side of my face has always been my bad side. However, I prefer this eye over this one. Like, I prefer that there's less eyelid space. Yeah, and I just like the shape of it. Like, I know that I had a little fat pad right in here, and that's another thing. I was very sure to be like, I don't want, please don't like scoop out the fat, you know, just whatever fat is attached to the skin, take that off. But I don't want, because I was so afraid of that Halloween look, you know, and I know that that usually happens when they take too much fat out. And so I was just like, you know, just leave the fat there. I was like, if I have to get another upper blepharoplasty in like 5 years or something, that's fine, but don't take extra fat out, you know. But I did have a little fat pad that was right there, and I feel like maybe he just took a little extra right there, because I feel like that's the only spot that's a little bit more space showing. Anyway, it doesn't really bother me. At first, it kind of did. It's so funny how you get used to being so asymmetrical, and you figure out how to do your makeup certain ways to make it look symmetrical. But once you get surgery, you're like, they're not perfectly symmetrical, you know? You're like, all of a sudden you have all these unrealistic expectations about how things should turn out. That was the only concern. I was like, I see a little bit more eyelid space on that side than I do on this side, but it's nothing compared to what it was before. You just start to really analyze things a lot more. And I'm a little bit of a perfectionist, so I mean, anyway. The next thing I wanted to talk about is the healing process. Y'all, it blows my ever-loving mind that the healing process was as simple as it was. To me, it was painless. It blows my mind that they literally took skin off my eyelids. I would think it would be so sensitive. It wasn't sensitive at all. Now, I was taking some medication. They give you some, I can't remember what it was. I still have it because I didn't use it all. I'm not the type. I'd rather deal with the pain than take medication. It's just weird. Even with ibuprofen. And so anyway, I did have some stuff that they gave me, and I did take it because it was my breasts that were pretty sore. But the eyes, oh my gosh, I'm just like, I even made a video that night. I mean, that evening, like after I'd come home and finally when the anesthesia wore off, I was up and I was like, had all this energy, and I was like, oh my gosh. And I made a little video just that evening, like, okay, this is day one, you know, and not painful at all. It wasn't nice to look at because my eyes were swollen. I didn't bruise at all, but my eyes were definitely swollen and the stitches were there. And it did freak me out a little bit because I did see a lot of extra eyelid space. But like I said, I knew that a lot of it was swelling, and so I thought for sure it's gonna go down. But the healing process was so simple. It just kind of blew my mind. Now I did use a product called Scar Away, and I would just keep my incisions covered after they took out the stitches. I would just keep that Scar Away. I think it's like a silicone. It just kind of blocks the air, and it's supposed to help them heal faster. I don't know if it does. I really doubt it. I think that my body was going to heal on its own anyway. Now I do feel, let me show you really, really close up. So I don't even know if you okay. I don't even know if you can see the scars. And they are almost like undetectable to me, and I know exactly where they are. You got to be really careful with what you believe on the internet sometimes. And I'm an open book, and I'm sure that most people are honest. But even if I came to you right now and said, look, I've never had eyelid surgery. Look, you can't see any scars. You would not, I don't know. Can you see any scars? I don't know. I guess I'm gonna have to wait until I watch this back. It's very hard for me to see my own scars, and I scar bad. Like, I've keloided before. I have a scar on my stomach about that long No, it's not that long. My stomach's not even that long. About that long. It's right down the middle. And it's in a zigzag because I had surgery when I was about 18 years old, I think. My abdomen was just pulling apart, and it was, I want to say, I don't remember all the terminology at the time. I was so young. I was just like, I just knew I needed to get something fixed. I think it was kind of like a hernia. My muscle was pulling apart. And so they went in and they thought it was only like this little up, way up here, turns, and then all of a sudden I have this scar almost all the way to my belly button, and I keloided. That's like the worst kind of scarring that you could possibly have. It looked like a worm was sitting on the top of my stomach. I actually had to have a reconstructive surgery to get rid of the scar. They cut the scar off, and then they cut it in a zigzag, hoping to take away the tension so that it wouldn't scar, and I still scarred. I still started to keloid. So they had to give me steroid shots all down the entire center of my stomach. Some of the most painful shots I've ever had in my life. It was so painful. But that just goes to show like how badly I scar. Now, with my breast implants, I didn't scar. I mean, I had just typical scars, but they healed perfectly fine. I thought that I might keloid up here. It's not common, supposedly, on the eyelids, but I knew it was a risk I was willing to take, because I was thinking, at least, even if they are cute, I'll just cover them with makeup or something like that. But I do know how they raise up above the skin. So anyway, I'm having the hardest time. I think I can barely see right there. Right here, I can feel a little bit, because where they tied the knots on the ends, I feel like that's where the scar tissue is still trying to heal a little bit. It's been 6 months, and they say usually around 6 months, it takes 6 months to a year for the scars to heal. And trust me, at the end of 6 months, you're not going to be able to see any scars. If I can almost not even find them now, you're not going to be able to see any. So I could have done this, and if I were a dishonest person, then I would be like, look, you can't see anything, But I'm not. And like I said, I don't think most people are dishonest on here. But these days, with all of the filters and all of that, like, I don't even know, whenever I'm watching videos now, especially on TikTok, because there's so many filters that you can use on TikTok. But one thing I love about TikTok is that if you use a filter, it shows on the screen what filter you're using. So you can't really lie about it, But these filters, they're just undetectable now. But I don't like playing around with those filters, because I always know I'm going to eventually run into somebody that sees me on YouTube. I have run into people several times. I would say it's been about 6 times, at least 6 times. I've had somebody come up to me and be like, "Are you on YouTube? Is your name Jennifer Jenkins?" And I'm like, "Oh my God." It's so, I don't know why. It just makes me feel so uncomfortable. I feel embarrassed. I feel like it's imbalanced, because I share so much, and so whoever I'm talking to knows probably so much more about me than I do them, and there's just an awkwardness. I love it, and I'm flattered, of course, but it definitely feels a little odd, very odd. But anyway, it's the reason why, I would never use filters. I don't like to alter my pictures too much. Now, if I have a blemish or something, if I have a big pimple, I might take whatever, in Photoshop and take that out. But I don't even know how to use these other apps, where you can use apps where you can like literally change the shape of your eye, give yourself different mouth, take off all your wrinkles and stuff like that. I'm not doing any of that. You can see in my pictures, you see my crow's feet clear as day. I'm not taking anything out, just because, like I said, if I run into somebody, even if it's just, if I post pictures on Facebook or Instagram and I run into some of my old classmates, I don't want them to be like, "God, you look nothing like your pictures," you know what I mean? Now, the only other thing that I did want to say about this, surgery, is that once you cross that line, once you go ahead and get plastic surgery, it's one thing to have filler. You guys know I've documented everything here on my channel. Anytime I've ever gotten filler, y'all, I have not gotten filler in over 2 years. I guess I have to check, but it was when I got my temples done and I had that bruise on my eye, and I started a video like that. I know my hair was pretty long, and so I think it was like 2 years ago. It was definitely 2 years ago. It's the last time I've gotten filler. I have not needed any touch-ups. You know, it's so funny because all these plastic surgeons and estheticians and stuff are like trying to talk people out. I see so many TikToks and posts and stuff like this. They're trying to talk you out of getting filler and instead doing plastic surgery, because they're saying now filler can stay in your body, you know, much longer than was originally, you know, thought. And I'm like, and that's bad how? Like whenever I got my temples done, my temples were so hollow. I want to say it cost like $1,200 to get my temples done, $1,100 or $1,200. Like, do you think there's anything in me that's like, golly, they told me that it was gonna, you know, start to dissolve on its own in like 12 months and it's been like 2 years now. Like, do you think I'm upset about that? I'm like, wow, I got more than my money's worth, you know, for sure, because I have never had to touch up my temples. Now, I did want to say though, it does backfire if you're not happy with something, because I feel like I got a little bit overfilled here the very last time. And I just thought, okay, well, hopefully, you know, it'll dissolve. There's like one little area right here that if I eat too much salt or if I'm, you know, dehydrated, then my face will swell and my filler will swell, I mean. And that's so funny. Like if you eat too much salt, if you eat too much sodium, instead of bags swelling, now your filler swells. And so some days my face looks, you know, just puffier than others. And it's because the filler everywhere has swelled a little bit, because it's hyaluronic acid and it draws water to itself and it swells. And so you still have to be careful, you know, with your salt intake, you know, whether you have bags or whether you have filler. So, but what I was going to say is that it can be a slippery slope when you start, once you've crossed that line to plastic surgery, because now I'm like, well, my eyes look a lot more youthful than they did before, but now I'm starting to see things down here. You know, I don't like how this looks, you know, and so I've already talked to this plastic surgeon about like, what do you do for this area, you know? And he does little, they're called, I guess, mini facelifts, and they just really just address your lower half like this. You know, I look at older pictures of myself and my chin area looks a lot smaller. I mean, it just looks like this. It looks that, now it would see that, it looks funny though, that doesn't look good, right? So I think they would have to pull up like here, but then also here. And imagine that. I don't know if I like that. My whole point was that once you cross that line, it can become kind of a slippery slope. And I'll be the first to admit, you know, after I got my eyes done, I was like, wow, my eyes, you know, I feel like I was able to kind of reverse time, because my eyes now look like they did when I was in my early 30s. My favorite age ever, I think, was 31. That's when I feel like I looked my best. And for me, it's not about looking super young, although I definitely love looking young. I would definitely love to look younger, you know. I'm not afraid to admit that. But I loved age 31 because I lost some of the baby fat, because I always had like a very round face. And so I didn't look like a little girl anymore, but I didn't quite look like a woman. It was almost that transition that I think is so beautiful. And I see it on a lot of 30-year-olds. I just think 30 is such a beautiful age where, I don't know, it just is a beautiful age for women, I think. I think there's so many people that were like 20, you know, 25 or 21 or something like that. But for me, I feel like 30 is so beautiful on most women. So after I got this surgery, I was like, my eyes look, I actually have more eyelid space than I did when I was 30. But I feel like it definitely looked like we reversed the hands of time a little bit without going overboard, you know? But then now I'm like, do my eyes match this part of my face, you know? I feel like they still look like aged eyes, mainly because my eyebrows are still kind of aged, you know, they've dropped a little bit and stuff like that. And of course I've got crow's feet and stuff like that. This is one of the reasons why I'm not somebody who goes and gets Botox every 3 to 4 months religiously. When I first started, when I was 36 years old is when I started getting Botox. I was religiously going in every 3-4 months and stuff like that. As I aged, I started going, I don't want to do that because then I'm frozen in certain areas, not my forehead, because I never do my forehead because I can't. And I've told y'all a billion times, it just drops my eyebrows. I look like Frankenstein. It looks so terrible. So I never do my forehead. I will always do right between my eyebrows, and then I will do my crow's feet, mainly because they have a limit. Like you can't buy less than 20 units. And so I'm just like, okay, let's do my crow's feet. But I don't really care about crow's feet that much. But when I do, when the crow's feet are gone and then it's kind of frozen in this area, all of a sudden I feel like my face looks imbalanced. And I'm not crazy about it, which is why I don't go very often. The only reason I go once a year is because I cannot stand, it's not even that I have 11s, because I don't have, I can make those, but I don't have them when I'm resting my face. It's because when I make certain expressions, when I'm joking, which I joke a lot, this part of my nose thins out, something like that. And it makes me look so old, and I hate it. It just gets real thin and real weird right there. But if I get one injection right there, then it just kind of flattens it out, and I feel like it makes my nose look straighter and everything, because I do have a crooked nose. I have a little bump right there, kind of sits off to this side. But when I have Botox there, it doesn't. And I don't have any Botox there right now. And that's the only thing that I'm sitting there like, do I want to spend, $200 just for that, and then have my crow's feet done and then hate the fact that I have my crow's feet done? Anyway, but the biggest reason is because I feel like it imbalances my face. If all of a sudden I am so frozen here, and that's not even noticeable to most people, and then my neck is not super tight and this area is not super tight, then it starts to look imbalanced. So anyway, I feel like I could go on and on and on about stuff like this, just because, I don't know, it's so interesting. It's so interesting what's available to us these days. If we choose to get plastic surgery, if we can afford to get plastic surgery, I did want to talk about that too. You don't have to be able to afford it. Well, sometimes you do. Like this doctor requires that you pay everything up front, and he does not finance. Some places do finance though. So when I got my first implants, y'all, I was 26 years old. I was a waitress, and I somehow was able to finance my boob job. And the reason I'm telling you that is because I know how down it can get you, the aging process, can make you feel. And I know it sounds so cliche to say, I want to look the way that I feel inside, but it's true. It seems like such a contradiction. And like I said in my last video, it's like people are so afraid to admit that they want to look younger. I don't know why. That's something that we're so afraid as women to admit, as if it says something bad about our character, and it's okay to want to look like you once did. In my last video, I was saying up until I was about 42, I thought that I was aging pretty well. But once, actually it was like 40, things started to go downhill really fast. And then I was like, I want my old face back. I want the face that I was familiar with back. It's not necessarily that I'm like, I want to look 20, because I don't want to look 20. I want to look 31. But I definitely want to look younger. I would love to look 20 years younger than I look right now. So many women are afraid to admit that. They're afraid that other women are going to shun them for not accepting the aging process, and you can accept, I'll accept all the great things that go along with the aging process. It's okay for you to want to address if your eyesight's not behaving like it did when it was younger, or your joints are not behaving like it did, or your hormones are not behaving. But the second you want your skin on your face to behave and look the way that it did when it was younger, all of a sudden people just have a problem with it. It's just bizarre. It's so weird where people decide to draw the line. It's like, now you're vain. Now, because if it has to do with your outward appearance, you're vain. Even though when you think about it, think about dental work. I feel like dental work is just as invasive, if not more so, than eyelid surgery. So anyway, because I can go on a whole tangent there also. These are, I've had these thoughts. I have these thoughts all the time. So that is all I have for you today. I feel like I've been sitting here forever. I know I have, because I can talk about this stuff all day long. I'm so glad that we live in a day and age where, we have options like this, should we choose to take them. It's not for everybody. Some people, it's not as important to. And sometimes I wish that were me, but it's just not. And so, so if you're somebody who's considering surgery, you know, whether it's an eye lift or a nose job or whatever, I hope that you love your results, because if you do, it is literally kind of life-changing, because unfortunately for a lot of people, the way that you feel about, you know, the reflection that you see in a mirror can really play a big role in how you operate in your daily life. And I hate that that's true, and for a lot of people it's not true, you know, but for me it is. And so this surgery really gave me, you know, some confidence back. And I hate saying that. I hate saying that it was making me feel not confident, but it really was. It's just, I don't get it. I don't, you know, like I said, I've said this so many times, I feel like Mother Nature and Father Time, they can be such bullies, especially, you know, after age 40, especially for women. I mean, you know, on top of having to go through the whole aging process and women just seen so differently than men when it comes to aging, we also have to go through perimenopause and menopause and our hormones just, you know, going crazy and not feeling like ourselves. And, you know, we get to have the babies and we get to, you know, I don't know, compromise our bodies for our children. And it's totally worth it. But some people don't bounce back, you know, and I'm glad that these things are available to women. You know, I'm shocked that my body bounced back after 2 kids. For some women, it's not the case. And I think it depends on how close in proximity you have your children. But how much weight, you know, you gain during your pregnancy and stuff like that. But anyway, I just think it's so wonderful that they have these mommy makeovers, you know, and they have all these things that are just available to us should we want to reverse the hands of time. And anyway, I'm obviously not going to judge anybody for doing it, because I'm over here doing it and I'll do it again. I'm going to definitely do something again. I've already got some, you know, I don't know, I'm already thinking about this little area right in here. So anyway, thank you so much for being here. I always appreciate your time. Like I said, if you have any questions that you want me to answer, go ahead and leave them below. I hope you're having a fantastic weekend, and hopefully I will see you back here next week.